Hello, good afternoon, everyone. This is a special budget update from the session. Last week, the budget went through the House and the Senate, and now there will be a conference committee to discuss our priorities and what we fund moving forward. The big debate was the inclusion or lack thereof of Medicaid expansion in one way or another. As you know, I've been firmly fighting for Medicaid expansion here in the House of Delegates for some time. It will actually save the Commonwealth $1 billion. I wanted to explain that to you. Right now, indigent care, which is largely funded through UVA and VCU, is funded by the state at well over 100. In 2016, it would be $148 million just for that year. These individuals could be covered under Medicaid expansion. Right now, the federal government pays about 50% of those costs for indigent care, but under expansion, they would pay at least 90% moving forward for most of those individuals. So by expanding the roles of Medicaid expansion, roles of Medicaid through Medicaid expansion, we actually will be able to alleviate portions of our state budget to the tune of over $1 billion over the next 8 years. So I know it sounds counterintuitive to some people, but I've done the math and I've gone and done some research. I wanted to show you, I've got this chart, if you can see it, that I went through and actually created. And there's the $1 billion that's reported, and even if you take the most conservative figures I could find, it's still a savings of over $90 million a year to the Commonwealth. And $90 million is certainly a lot when you factor in all that we had to cut in order to ensure that we fund certain healthcare priorities. So what's actually happening? Well, in the House bill, the House budget that we've created here, unfortunately, what it does is it funds a lot of healthcare initiatives. So that way the hospitals and other special interests will feel like we're doing something about healthcare. But what has actually been done is we've cut from so many other parts of the budget in order to help facilitate the vast expansion in the funding of healthcare. I'll give you an example. We reduced law enforcement by $7.2 million, which is what we call 599 funding. School resource officers, $1.5 million. Foster care, almost $5 million. Economic development, so many economic development programs were cut in this year's budget just to help make room to put more spending into healthcare. So to mask the reality that we need Medicaid expansion. One big thing, the Housing Trust Fund, which helps to offer low-interest loans to families in need to purchase homes, that was completely raided. So don't let the numbers fool you, folks, as far as what's being funded and what's not being funded. I really feel as though there's a lot more that we can be doing to be more fiscally responsible and take advantage of this expansion, and it would really help us here in the Commonwealth. 25, 27 other states have already figured this out. It's only a matter of time before we come to our senses and find a Virginia solution. I have been an advocate for even a compromise that came out of the Senate, which instead of full expansion of Medicaid, we would offer at least a private option for people to enroll in. And then that would be subsidized. That would help to alleviate some of the concerns that we hear from the other side, but they have just been relentless with no, and have not offered up any other solutions. So we'll keep fighting the good fight. Hopefully in the coming week or two we'll find some kind of consensus, but in the end we just want to make sure that the families of Virginia have access to affordable and accessible health care, as you know I've been pushing for many years. So if you have any thoughts, feel free to reach out to me. Thanks for everyone that has contacted me thus far with a variety of ideas. We'll just keep pushing. Thanks.